Yes, so today we dive into secrets to passing the NCLEX in just 85 questions. When you talk to people who have done the test, some would say, oh, I did the NCLEX and yes, everything ended at 85. Someone would also say the test continued all the way to like 150. And sometimes you're wondering, how is it going to be for me? And not knowing what to expect can even make you anxious. But as we go through this session, you're going to just be relaxed, knowing that whichever way it goes, your preparation matters, and then you will surely pass. But today the focus will be to help you to know the strategies to be able to do the test very well so that you will finish with ease and then finish with just 85 questions. So let's start right away. I'll quickly go through this because we know about the NCLEX already. So I'll quickly go through this one. So we know about the NCLEX exam and what it's about so that you can be a licensed nurse and be able to practice the US or Canada. So we have the RN and then the PN. So RN, registered nurses, PN for practical vocational nurses. So let's look at this. So it's important, if you want to pass this exam, you have to know what NCLEX requires of you. That is a kind of CAT exam, computerized adaptive testing, and then your clinical judgment will also be tested. So every question you are seeing has been crafted to test your clinical judgment. So it's not there. Yes, baby says yes. It's not there to just test. It's not there to just test what you have memorized. It is there to test how much you can judge cases and take the right ones. Yes, so let's go on. So clinical judgment is so needed. Okay, so let's look at the strategies so that you can approach this exam with a lot of confidence. So based on the blueprints, these are the content areas. So as you are studying, you should have the content areas written down so that for every topic you decide to study, make sure you are covering these key content areas. They include safe and effective care environment, and that would have topics from safety, infection control, and then management of care. The second one is health promotion and maintenance, where you have questions on growth, development, and then prevention. And then we have psychosocial integrity. That is all about psychiatry, all around psychiatry, mental health, and then coping strategies, and then stress management. We also have the fourth one, physiological integrity, where you will have all the systems. So for physiological integrity, you're going to have the nervous system, the respiratory system, GI system, that's where you have all the systems, okay? And then we have pharmacology, reduction of risk, and then complex care. So for all of these domains, you are not just going to study, you are going to understand it so that you can judge the cases correctly. So clinical judgment is so needed. So when we say CAT, that is the exam format, okay? It is adapting to how you are testing. So two people will be writing the NCLEX at the same time, even in the same center, but they are not going to have the same kind of questions. Maybe yours will start with pharmacology and the other candidate will have maybe pediatrics starting. And then as you start, the computer starts to adapt to how you are testing. So as Julia started the exam, and then Julia was presented with pharmacology questions, and she's not doing so well on that. So the computer adapted to how I am testing, and then computer decides to present more questions in that area to me. So it's going to adapt to how you test. So no two NCLEX exam will be the same. Okay, although we have the same content format, it's not going to be the same, okay? So the length is that you can have a minimum of 85 questions or a maximum of 150. And you can pass at any point when the computer decides that, okay, with how Julia is testing, she is a safe nurse and we are 95% at that 95% confidence level that she is safe and that she should pass. So at that point, the computer has detected it and then it will shut. But if at a point the computer has detected 95%, it has tested you on all levels, giving you all the chance, presented different kinds of questions with different level of difficulty to you, but it's still detecting that you are not safe. So that's when at that point, the computer decide that, yeah, I have that 95% confidence interval that this candidate is not safe, and then it can shut. So when you are testing, you're going to have different kinds of questions, multiple choice, select all that apply. I think I showed you the website and that area where you have the chance to see the different kind of questions and how they look like. Do well to check the website again. You have all these type of stuff, even audio and then graphic-based questions, drag and drop, hotspot images. You have an image and you're supposed to point. Yeah, so maybe there's an image and then there is you have the ear and then you're being asked if a client takes maybe this kind of antibiotic and you know that the antibiotic has ototoxicity and you are being asked point to which part of the body that client would have maybe a complication with when given this medication, and you know it's ototoxicity, and so you point to the ear. Okay, so that's what the hotspot images are. So this is how the CAT works. I think I've explained it a bit. Let me add more. It's each answer will recalculate your ability estimate. So any answer you choose, the computer will just check. Is he or she answering correctly? So mostly when you answer correct, you get a harder question. And when you answer incorrect, the computer is trying to adapt to your level. So it gives maybe an easier one. So sometimes many would say that if it's getting harder, then maybe you are passing. But if it's getting harder, and that getting harder is relative, maybe it may be hard for you, but it's even an easy question. So the goal is that you are going to remain focused through it all, whether it's going to stop at 85 or it's going to take you through it all to 150. Do not lose steam. Stay focused. Do not focus on what you may have heard that, oh, I passed 85. Why am I not doing well? Just stay focused, because if you entertain a lot of doubt and you are thinking about a whole lot of possibilities, you will lose focus. You have anxiety coming in. And when you are anxious, you shut your prefrontal cortex, which helps you to think so well, which helps you with executive functioning. So do not shut your prefrontal cortex at the time you need it most. Okay, when you get anxious, you activate your amygdala, which is at the back part of your brain. It tells your brain that, whoa, we are in trouble. Let's gather adrenaline. Let's get ready. Fly. Let's get ready to flee. Okay. So the exam would end when 95% confidence that you are above the passing level or you are below. And then it can end when you hit the maximum number of questions or when you run out of time. Okay. So whether it's going to end at 85 or it's going to continue to 150, do not be anxious. Just stay focused, okay? So let's look at the passing standard. You may be wondering, so what determines whether I've passed or not? So the passing standard is being set by the NCSBN and then every 3 years based on the national practice data. So the passing line is the minimum level of ability for safe practice. So the level that they know that, okay, at this level, this nurse is safe to get a license. So you don't need to get every question right, okay? Just show consistent, safe judgment. NCLEX is a safety exam. It's just checking whether you are safe to practice. So Safety, safety, safety should be at the back of your mind. So you can pass even with only 55% correct if those are high-level questions and the computer detects that, with all of these questions that she got, she is safe and she's good to go. So it's not about percentages like, oh, maybe I got 70% or 80%, so I've passed. No, it's about your ability and your judgment. And other questions weigh more in the determining ability. So a candidate who will show consistent safety early. So if you started and you are doing so well, the computer is detecting that you are safe, then likely that at 85 questions, you will be good to go. So why some pass with just 85 questions? So let's get that so that you prepare yourself so that you can finish right at 85. You demonstrated strongly critical thinking and safe judgment. Like right from the beginning, you're judging correctly, you're thinking critically, and then you're choosing the right answers. And then currently, you're getting medium to hard level questions correct. The computer presents a medium level questions, you got it. It was hard, you got it. The computer sees that, whoa, this is a safe nurse. And then you avoid critical unsafe mistakes, like wrong delegation and you choosing the wrong ones. Like, you're making the computer confused. Is this nurse safe? No, I don't think she's safe. And then life-threatening prioritization errors. Like, you do not have to do that. Okay, more like the computer is not happy with you. Like, what is she doing? So stay calm and make sound decisions under pressure. Sometimes the exam is not even only testing, it's not even testing only content, because it's a long exam over 5 hours, and it's also testing your resilience and then your composure. So you might know the content, but if you lose steam along the line, you are not well composed, you might end up making like the wrong judgment. So that is why your composure is very important. Okay, so they are judging. This is the clinical judgment model. So this is how they're going to judge how well you are doing. So you should be able to recognize cues. I remember we did some questions around case studies and all that, and I made sure I brought questions that would test these, that you can recognize the cue, that you have some data presented to you and you can quickly pick that the respiratory rate is high. If you cannot pick it, then like you are not safe. Okay, so that's why when you are studying, you're not just cramming, you want to understand it so that you can recognize the cues. And when you recognize it, how will you analyze it? That this is a patient who has been on opioid and the respiratory rate is very low. How are you able to link it? That I've seen that the respiratory rate is that low. So what's happening here? Okay, opioids will cause respiratory depression, so that's exactly what is happening. So you should be able to recognize the cue, analyze, prioritize, like what's urgent to attend to, and then generate solutions, take action, evaluate outcomes. So that's why you have case studies, and for each case study, you're going to have it in 6 parts. So it's going to be under these topics. The first one, they want you to recognize it, analyze the cue, go through the motions all the way to 6, evaluate the outcomes. So when you get a case study, do not panic, especially if you are not like conversant with a topic. Let's say it's a case study around acetaminophen toxicity, and you realize that, oh my God, I think I did not really look at it. What would be the antidote? So you are not so sure. Is it N-acetylcysteine? Do not lose steam. Although you go going to have 6 parts of it, just be well composed, think through it well and well. And when you are getting a lot of case studies being presented to you, just stay focused and go through it systematically and you will be fine. So this is the reports that candidates receive when they do not make it in the exam. So you have to do well and look at it, because you are not waiting to not make it to receive yours before you assess it. You have to, it's online. I picked this online. You have to look at it and then prioritize your studies, craft your study plan around it, and prepare. So when the candidate did not make it, that candidate receives this report. And they are telling that candidate that these are the domains we tested you on, and this was your performance level. So that means that you too, you are going to be tested on this same domain. So management of care, what's my aim? I want to get above the passing standard, because when you are getting a lot of belows, it's not likely that you're going to pass. So management of care, safety and infection controls, health promotion and maintenance, psychosocial integrity, basic care, comfort, pharmacology and parental therapies, reduction of risk potential, and physiological adaptation. So physiological adaptation, I mentioned earlier, that one has all of the systems. So whether it's GIT, nervous system, respiratory system, musculoskeletal. So if you have 3 months to study for your NCLEX, and for the first 2 months, all you've been doing has been studying around systems, then you are just covering only this. What about this? And it's interesting that there are some categories here which takes like a higher percentage, especially pharmacology and then management of care. So you should know the weight of every category so that you prioritize it when you are studying. And your aim is that you want to let the system know that you are safe and you're targeting getting above the passing standard. But it doesn't mean that you have to get above the passing standard in every category before you will pass. The computer will determine it when the computer knows that, yeah, you are safe, okay? And then this is also on the report. So it means that they are going to test you, your clinical judgment under these 6 modules that I spoke to you about earlier. So do well to plan how you're going to study. It's not going to be graded by the sections that I showed you. The pass or fail will be based on your overall ability when the computer determines that like you are safe, okay? So mostly candidates will receive this report because yes, they did not make it and they are wondering what happened. So you get this report to show you, yeah, maybe you having issues with analyzing cues and all of that, so that when you are preparing or you even have this and you realize, okay, it looks like I'm weak in management of care, and then it guides you in your prep to go take the test again. Yeah, so it helps you so that you can plan your studies. So you will pass when your overall ability is above the passing standard at the point that the CAT makes its decision that yes, 95% confident interval rule, yeah, you are safe and you are good to go. So practically being consistently at or above the standard, especially in the heavily weighted categories like management of care, is so key. Like delegation, prioritization, you must be on top of that topic. Pharmacology, remember I told you about pharmacology. Yes, and we have a pharmacology crash course. If you want to ace that part, yeah, you can grab it. I'll surely share it in the chat box when I am done. And then reduction of risk potential is around like labs and all of that. And then physiological adaptation, the systems. So as you are doing well in the major categories, it boosts your ability to just pass early and finish at 85. You can find all these from the website there, nclesbn.org. So let me explain this so that you will get to understand the CPR better. So if someone has above in the safety and infection control portion, and then near passing in pharmacology, and then below in management of care and physiological adaptation, it means that, so management of care, the candidate got below. It means that the candidate is not doing so well when it comes to prioritization and delegation, which forms a chunk of management of care. So, and also physiological adaptation, so acute physio physiological errors. So the candidate was making errors in that area. So it helps you to know that, oh, I'm weak in this area and I've got to like fix it. Okay. If you have a candidate who got like a lot of multiple near passing, but no below passing, it means that that candidate was kind of close, but it was still not up to the standard. So you have to do well, look at the areas where you didn't do so well, and then maximize your preparation there, aiming to get above. And as you aim to get more of the above passing, it boosts your overall like pass. So the bottom line is that you are not forcing that, oh, I have to get up. Yes, it's great that you are getting above the passing or for all of the categories. But you have to do well, work on your clinical judgment, work on your content so that your overall ability to decide will just show. The computer will just pick it up that you are safe, and then you can have your exam ending quick for you. So when you're going for the test, it's not just about content. Content is key. I remember I gave you 3 more strategies. That first, your mindset, master your mindset, and then the content, and then test taking strategy. You should know how you're going to test. Look for, when you're doing prioritization, look for what will save your client over comfort, choosing comfort options. So when you have these at the back of your mind, it helps you so that even when you do not know, you just apply these and it helps you to be able to choose the correct answer. Remember, we did prioritization as well, ABC. So airway, breathing, circulation, and then remember the Maslow's hierarchy. So they should guide you in your selection. Remember stable versus unstable, when you're supposed to know who to let the RN handle. And remember this as well, that we do not delegate. Is an acronym, what you can eat. The EAT being, if you're supposed to evaluate as an RN, you're supposed to assess, you're supposed to teach. Do not delegate this. So anywhere you see a question around this, it should be easy for you to be able to choose the correct answer. And then in infection control, we have a lot of mnemonics. I think the last time we did that, I gave you some mnemonics like airborne precautions, contact precautions. Do well to revise those areas as well. So I'm going to give some scenarios so that when you write in the exam and you find yourself in those scenarios, where you remember what I shared and then you do the right thing. Let's say Maria was answering and then 60% like correct answers, but she's second guessing like every question, and she starts to change the correct answers even to the wrong ones, although she was doing so well. So when you find yourself in that situation, remember that you prepared and you should be confident in the answers that you are choosing. If you really thought through and you are sure the first answer mostly is like your safe answer, and you only change it when you realize that, oh, okay, maybe I missed some keywords and I didn't see it too well, and that's why I chose that the first time. And now after rereading, I think this is the correct answer. Because when you overthink more, you might end up changing a lot of your correct answers. So that is so key to you passing. And then the candidate who is panicking. A lot of candidates panic. They start the exam and maybe the first few questions, mostly it would be difficult. For a lot of candidates, they have the first few questions being very difficult and they start to panic. Wow, if it's starting this way, how is it going to end? And they start thinking a whole lot that, oh my God, I don't think I'm going to make it, so I'm going to write NCLEX again. Why are you shooting yourself in the foot right when you have started? You just started the marathon. Just stay calm, take deep breaths, and read the question well, and go through all of your questions so you can choose the right answers. So if you started and you getting select all that apply. Last week we did strategies. You can catch the replay inside the Facebook group, how to take the right answers for select all that apply questions. And you are all over the place and you don't know what to do and you lose your focus. Do not do that. Some candidates will get a lot of case studies and oh my God, I read that candidates who get a lot of case studies, it means you are not doing well. Do not start shooting yourself in the foot right in the exam hall. So don't do that. Don't assume that you are failing and become anxious. Don't misinterpret the fact that the exam is becoming difficult. Do not interpret it as failure. Understand that sometimes hard questions mean that, yeah, you are near or above the passing standard. So just keep your composure and do not let anxiety sabotage your performance. Just stay calm. And some candidates are rushing. They are rushing, they're in a hurry and answering like 85 questions in like 45 minutes. Why are you in a hurry? You have time. So when you do that, you end up missing keywords. The question was asking, what will be the first thing you do? What will be the priority? You did not see that and you end up choosing the wrong one. Just slow down, okay? Because you have time. You can even have like 1 to 1.5 minutes per question. So NCLEX is testing your clinical judgment. It's not so much about the speed. Yeah, you have to keep your eye on the time, but the thinking is super important. So to pass with ease and finish just at 85 questions, you have to start practicing now. Just like we have the athletes preparing for a marathon, we have Usain Bolt. When he's preparing for that run, he puts himself in that same situation, like what will happen during the marathon. They rehearse that over and over again. So on the day of the marathon, it's just like another rehearsal. So that's what you're supposed to do. Do daily, consistent practice. Like practice a lot of questions. Let's say give yourself 85 questions daily. Move to 90, move to 100, move all the way up. Okay, so that you have tested yourself over and over again. You have built the muscle for test-taking strategies, for speed, for thinking under pressure, for sitting down for long hours. You have built it already. So when you go for the exam, yeah, it's going to be, yes, it's the exam itself, but you may have put yourself in that situation a lot of times and the anxiety will be less. So when you do your practice questions, to do well to review rationales as well, not just knowing the correct answer. What if you do not meet that same question, but the rationale, understanding it will help you answer another question. So simulating the real test condition is so helpful. It should not be that when you are going to take the NCLEX, that's the only time you're going to sit down for that long, 4 to 5 hours to do an exam. You have to rehearse that, focus on the endurance, okay, that you can stay calm, you can stay focused, you're not fidgeting, you are not used to sitting at one place. Maybe you have issues with your back, you're having waist pain. You have to anticipate all of that, because it should not be that you knew your content, but all the because of external factors, you did not do well with the exam. No, you cannot afford to be in that situation. So make sure you are covering all the other parts so that together you can ace the exam. And take good care of yourself. The fact that you have an impending exam does not mean you should not take good care of yourself. Rest when you have to, eat well, pray, meditate, and put yourself in that calm mode so that you can have the success. So from all that I've shared, remember, NCLEX is not about perfection. It's safety, it's safety. It's testing that you are safe nurse and you are safe to practice, you are safe to have the license. So mostly when you are consistent right from the very beginning, you are judging correctly, then it's so likely that at 85, you will be done. So enter the exam hall knowing that you are a safe nurse and that you are going to judge correctly and then choose the right answer. If you do that, the exam will stop early and you will surely come out knowing, yes, that you will do well. So do not focus on failing. Do not focus on the stories that you may have heard. Just stay calm and prepare with the right strategies. And then on the day of the exam, walk into the exam hall confident that yes, you have prepared. And if you're a believer, you know that God is also on your side, and together you're going to come out with your success story. So you have worked hard, you are ready. Go out there and ace the exam. So remember this, I said earlier, master your mindset, master the content, and master the strategy. So that is why here we want to journey with you, because we do not only give you content, we give you strategies as well, and we give you mindset boosts, because you being in the right frame of mind like covers a high percentage, and it helps you to walk in confident and then even remember the content you have in your head, and also with the right strategies you can pass. So this is our website. You can screen grab this, check our courses we have in there. I'll drop the link in the chat box as well, so that if you want us to guide you in your preparation, you have some time, whether you have a month, 2 months, 3 months, let us know, and let's see how we can tailor your preparation based on the blueprints that you have to use for your preparation, and then you will go and ace the NCLEX. So do not be discouraged. You may have heard this today and it looks like you did not start off with your preparation well. No, do not be discouraged by any setback. Use them as stepping stones to reach your goal. Even when, just like today, when I started, see how baby was all over the place. It would be like it's a setback, but hey, I was not discouraged. And I've come back and I've been able to finish up, and here we are at the end of our session. And I know that it's been insightful for you. Has it been a blessing? Share in the chat. I always would want to have your feedback, whether it's answered a lot of questions on your mind, whether it's giving you clarity, whatever is done, this session has done for you. Let me know. So